Thank you. I'm Steve Roberts from Healios. This is a digital online company that provides access for patients to clinicians within a short time to provide them with the treatment they need when they need it. Often we can get to most patients within 2 weeks of referral, so it's a rapid online service. It was developed based on the experience of our founder, who had serious mental health issues within his family, couldn't get the help and support when he needed it, so left the job and set the company up in 2013. Which is the... So it's built around the needs and the young patient and the family. I'll come back to the family in a minute, but we want to make sure it was outcome-based. Everything we do, we set baselines, we follow up, so we have clear outcome measures on everything we deliver. And we work with the local trust to set those outcome measures and use the same measures so we can use like with like. Quality is really key on that, to make sure everything's monitored and we maintain the standards, that we have the capacity, because we build on a national team that can provide clinicians available when required across the country, utilising resources there, and it's sustainable in making sure we do that in a cost-effective way, making sure people only pay for the services they actually need. We've covered most of those. One of the key issues, we use the technology to bring people together, because it's very important. We found that if we get the family involved, outcomes are significantly better. Here's an example with anorexia patients. If they just treat the patient themselves, outcome at 5 years, 36% had good outcome, where if the family's involved, 90% of those patients had good outcomes. So it's again bringing both the family and the patients together. We've already talked about this, a number of the speakers, that the increasing access to technology, so particularly with the young people. And again, it's making sure when we're talking about digital technologies that we appreciate that this is a technology that they've grown up with. They are more comfortable talking to their friends online, on the apps, on the phone, etc., than they are probably talking in a face-to-face situation. So what we can provide a whole series of interventions, both in terms of assessments and psychological therapy. Everything we do is to nice guidance, and we have currently had endorsement on our CBT therapy and on our early intervention psychosis therapies endorsed by NICE. So everything we do, we work towards those. We have a number of interventions. We have an avatar, which can be used for stepping up treatment and stepping down treatment. This is a self-learning algorithm that's used within that can provide support. And again, something Jake was talking about is having that support, and patients have talked about this, is having a physician in the pocket that they can refer to when they have any problems. We also have an app that uses the experience of both the patient and the family to monitor how they're progressing. So again, early identification of any crises that are coming up. We can use that, we can use that as a method of informing care coordinators of which patients perhaps need an intervention on a particular day, rather than waiting for a particular appointment to come through. So we have those assessment and diagnosis, but the main one is this face-to-face or eyeball-to-eyeball intervention that allows patients to access treatment in an area that they are comfortable with. So you could have the child in the bedroom, mum downstairs, dad at work. Everybody can be involved within the intervention at a time and place that suits. We operate from 8 in the morning to 9 at night, 7 days a week. And patients also have access to telephone support should they have any issues and queries between 8 a.m. and 10 p.m. 7 days a week. So we've covered that one. We're actually working in terms, and somebody's mentioned this, but developing the pathways. The service we offer is not an either-or. We like to work with the local trusts to integrate us within the pathway. We are presented as part of the services provided by that trust. It's an integrated service in aims to ensure people have both choice and can access services in a way that they actually want and feel safe and comfortable in accessing those services. So we work with the trust to develop those pathways. And I said, I've covered this really. We can have a whole range, we can use a whole range of tools from the company to develop that pathway, and has been talked about, repeated by a number of the speakers today, about having this end-to-end service. Thank you.